Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a very interesting show tonight. We're talking about plastic and reconstructive surgery. It's not just cosmetic, as many people think. We'll discuss surgical treatment options for a variety of issues, and we'll be joined by a panel of the leading medical professionals in the field, hearing patient stories of success and taking questions from our live studio audience. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at plastic and reconstructive surgery with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have a 5-star panel of guests today on Health Now. Joining me first is Dr. Lino Mealy, a board-certified surgeon with an expertise in the surgical management of cancer and traumatic injury. He went on to pursue his medical training in plastic, reconstructive, and aesthetic surgery at the University of Pittsburgh, one of the top 3 plastic surgery training programs in the United States. Dr. Mealy has extensive experience and interest with microsurgery procedures for a variety of cases. He's a native of the Lehigh Valley and is happy to have returned to his roots and be a part of the St. Luke's team.
The most rewarding part of my job is achieving the result that the patient wants. If we can make that happen, then we've done our job. I chose plastic surgery because it's quality of life surgery. Professionally, it's a field without boundaries. We're constantly innovating, and it's something that has become a tremendous challenge, I think, with each and every case, and it's very rewarding. Open communication with our team is critically important, especially since there aren't a lot of algorithms that we can use in our field. This isn't what I'd like to refer to as cookie-cutter surgery. So with each and every patient, there's a tailor-made plan, and that's what makes the communication with my team members very, very important.
Welcome, Dr. Mealy. Thanks for being here. Dr. Mealy, often when people mention plastic surgery, they think of the cosmetic procedures. And while that's a part of the field, can you tell us a little bit more about the types of surgeries and other procedures that you perform?
Well, the majority of what we do is reconstructive in nature. So very often it's under rather bad circumstances after a traumatic injury, a car accident, or after some type of cancer surgery. And we're generally consulted by another surgeon, sometimes in advance with cancer operations of the head and neck when they anticipate a large resection that's going to require some element of reconstruction. And we're the problem solvers. So we go into an operation with a plan A through E, for instance.
Wow, that many.
Mm-hmm. And sometimes you have to go to the plan E, hopefully not. Usually the plan A you've discussed in detail with the patient, you've discussed all the options with the patient beforehand, and we go and do the best we can to achieve the result that the patient's looking for. And what we're really focused on is regaining form and function for the patient.
Which is so critical to really their overall health and well-being, but of course the aesthetic and the artistry really comes into play as well.
Absolutely.
Great, thank you so much. Joining our panel next is Dr. Juan Carlos Martinez. Dr. Martinez is a board-certified surgeon who completed his surgical residency at St. Luke's, where he was named Surgical Resident of the Year. He then went on for fellowship training in reconstructive, aesthetic surgery, and microsurgery at both the Ohio State University and the James Cancer Hospital. Dr. Martinez specializes in advanced breast reconstruction procedures, body contouring after weight loss surgery, and migraine treatment with surgery and Botox, just to name a few. He's proud to be a part of the St. Luke's team and hopes to bring his patients health and healing through his innovative care.
When I see patients, I try to be much of a listener. I really like to sit down and really try to listen to what the patient is concerned, what are their problems, what are the things that they're looking for. And that will help me the most, to try to decide what can I do for them. And if I can actually do something for them, is very important to me. And then after that, for me, it's more about providing information, really try to educate about their problems and things that plastic surgery can do for them. I get to see new patients in consultation where they come to see me and they approach it with a problem and try to find a solution for them. One of the beautiful things about being a plastic surgeon is that what you do in a patient, the surgeries you perform, the results are immediate. You see their faces when they look at what they have come from before and after, and it's a very rewarding feel as a surgeon.
Welcome, Dr. Martinez. Thanks for being here. In your practice, Dr. Martinez, you work with a variety of physicians across many different fields. How important is the communication between all of the doctors and people in the practices, and what role does that play in your patient care?
Yeah, it's a great question. So healthcare in general has moved away from individual care, more like a generalized disease. So things are approached more in a multidisciplinary fashion. So as a plastic surgeon, we're in a very unique position that we can support a lot of the services in the hospitals. This can be in a reconstructive manner, from defects from the head to toe, wounds, hand, trauma, pediatric surgery, as well as cosmetic surgery as well. So it's a very unique field that allows to restore form and function in a variety of problems that we find on a daily basis.
Great, thanks, Dr. Martinez. Let's meet our final panelist. Joanne Mulligan is a physician assistant in the St. Luke's Plastic and Reconstructive Surgery Group. She received her training from King's College and worked in the operating room for several years before moving into more direct patient care. She works closely with both the physicians and the staff to coordinate the best care and surgical options available to her patients. Joanne, a cervical cancer survivor herself, is inspired by her patients' resiliency and is proud to play a role in their healing process.
I enjoy what I do. I feel like it's an honor to do what I do. I'm a physician assistant and I work in the office with Dr. Morrissey. I also assist him in the operating room. I see patients on my own. I also collaborate with him to make plans for the patients and decide their treatment. To me, there's just nothing more fascinating than the human body. It's dynamic, it's always different, it's changing. Every year we're learning more and more. It's just amazing to me. Helping people makes me feel so good. It's just wonderful when someone comes to you with a difficult problem, you manage it, and afterwards they're satisfied. It makes you want to come to work every day.
Joanne, thanks so much for being here. As a physician assistant, what is your primary role within the group and with patient care?
Basically, I see patients just like the surgeons do, but I help them to see more patients. They can spend a little more time with more complicated cases, but I can take care of skin cancers, get people set up for surgery.
And at what point do you know when you see a patient when you need to bring one of the physicians into the conversation? Are you sort of that first line and then they're brought in, or does that happen before you even get involved?
There are times when I don't need them initially. I can set them up for surgery, and then the surgeon will come in and see them the day of surgery, if the patient's comfortable with that. If it's something that I feel the surgeon needs just take a look at, just get their hands on and get a better idea, or if it's out of my comfort level and I just want another opinion as to the game plan, what to do, then I'll bring them in.
Thank you all for giving us a better understanding of your individual roles and the roles that your teams play in offering advanced plastic surgery options at St. Luke's. Coming up, we'll dig deeper into how the panel works together to solve complex surgical issues, what new technologies are available, and we'll hear from their patients and our audience later in the show. Stay tuned, we'll be back after a short break. You're watching St. Luke's Health Now.
My story started December 9th. I found out that I had HER2 positive breast cancer. I'm 2 years cancer-free, so that is very exciting for me. I could have had a lumpectomy, just one of my breasts removed, but I decided to have both of them removed. My chances of the cancer coming back was less if I did the double mastectomy, and I'm very happy that I did. Once I met with Dr. Riley and we decided that I was going to go for the double mastectomy, he set me up with a plastic surgeon, Dr. Morrissey. It was very important for me to have the plastic surgery after my treatment was done with my chemo. I just wanted to be back to normal, be normal, look normal. Morrissey made me get back to the way I was. I have a wonderful life, and I'm so fortunate, and I'm so happy. And it's from the doctors at St. Luke's.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being here today and providing us with questions, which we'll get to later in the show. I'm joined by an outstanding panel of plastic and reconstructive medical professionals, Dr. Lino Mealy, Dr. Juan Martinez, and physician assistant Joanne Mulligan. We've discussed their individual roles, and now let's get a better understanding of some of the plastic and reconstruction surgical procedures available at St. Luke's University Health Network. Dr. Mealy, what role does reconstructive surgery play in a patient's overall health? We think of the physical aspects, but there really are other things like emotional and psychological that come into play.
Well, there are both. For the breast cancer patient, for instance, it's devastating to wake up from surgery without a breast, just a constant reminder of that disease process. There are functional aspects of reconstructive surgery that may allow them to have better physical health as well, in the body contouring patient, for instance. There's a lot of research that suggests, and I find it in my own patients, that after I perform an excision or a paniculectomy procedure, which excises or removes a lot of that excess skin, that they're able to lose more weight or actually keep the weight off.
You know, Dr. Martinez, you mentioned breast reconstruction. You specialize in a procedure known as DIEP, D-I-E-P, and it's unique. Can you explain to us what it is and why it's sometimes a good option?
Yes, so the DIP is a very technical term explaining, saying deep inferior epigastric artery perforated flap. And basically just using your abdominal tissue, kind of like having a tummy tuck, but basically you take the vessels that supply that tissue and reconnect them to the chest and make a breast. The things actually with it comes is like using your own tissue stays there forever and doesn't go with the complications that can happen with implants, that they can fail with time and they can get infected and requiring to start from zero, from scratch. So once that tissue takes, it's all you, and it's a very natural feel.
That is really, truly amazing technology to be able to do something like that. And you get a sort of slimmer tummy in the process.
It gets tighter belly.
Wow, that's
for sure.
a win-win. Joanne, when a patient comes in to see you, how do you and the group help determine their surgical options and sort of figure out what's best for them?
It's a great question. I mean, all patients are unique. Their problems, their cancers, they're all unique. And there's always different ways to approach it. Sometimes we have different options we can offer them where we work with another dermatologist, or we will do all their procedures for them. We present it to them in a neutral manner and allow them to make the decision so that, again, they're in charge of their bodies and the decisions being made.
Yeah, I think it's important that we note that the patient is really a very important part of this entire process when it comes to reconstructive surgery. Dr. Mealy, you have a keen interest and specialization in microsurgery. Explain to us what that is and what types of procedures is it best suited for?
Well, microsurgery is a topic that describes a broad set of procedures. What essentially is borrowing tissue, really removing tissue from one part of the body, putting it in another part of the body, and connecting a blood vessel that's attached to that tissue to a blood vessel near the site of the defect that we're trying to reconstruct. It's often used in breast reconstruction. The DIEP is a microsurgical procedure. It's also used a lot in head and neck reconstruction. And what this technique really allows us to do is reconstruct defects that were seemingly impossible to reconstruct, even 20, 30 years ago, where we're now able to move tissue, create less morbidity or less of a problem from where we borrow that tissue. And it requires the use of a microscope, and it's really sewing blood vessels together that are on the order of 2-3 millimeters in diameter, which is can be even smaller than cardiac bypass surgery.
Another amazing procedure that you're doing a lot of, Dr. Martinez, is body contouring. Who's a great candidate for that, and how much of it are you doing?
So body contouring in and of itself is a very general term that basically describes any procedure done in the body to restore form and function. So patients of obesity go through the process of approval either with weight loss, by exercise and diet, as well for bariatric surgery. So as a plastic surgeon, we work and support those services in the same way, because at the end of the road, when they lose the weight, some of those patients lost adipose tissue, there's a lot of deflation, there's a lot of sagging of the skin that you don't think about it at the beginning, but at the end, they're all noticeable.
Exactly, and that's
So as
something
a plastic
really...
surgeon, you're able to kind of restore things and tighten them up.
That's great. It's just so interesting how many areas these different microsurgeries and body contouring can really help. That's been a lot of great information from our panelists, but we're not done yet. After the break, we'll learn more about the role plastic and reconstructive surgery play in trauma. You're watching St. Luke's Health Now.
2011, I had weight loss surgery, gastric bypass, at a different hospital. And then throughout the years, I started having some stomach problems. I actually followed up with Dr. Elchar at St. Luke's. After a procedure with him, he had realized that my surgery was not done properly. So he did a correction. The nice thing about Dr. Morrissey is he wants to do what's best for you and what's safest for you. I work out a lot, and you still look in the mirror and think, I'm working so hard, but I have all this skin left. You want to look as good as you feel. Definitely the plastic surgery has done that. I stand taller and hold my head up high and walk with a lot more confidence. It's been pretty amazing.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have an incredibly interesting show tonight. We're talking plastic and reconstructive surgery and what you need to know about your options for treating a variety of health issues. We're also hearing patient stories of success and taking questions from our live studio audience. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Dr. Lino Mealy, Dr. Juan Martinez, and physician assistant Joanne Mulligan. Thank you all for being here. In the first part of the program, we talked about some options available to patients, but plastic and reconstructive surgery also plays a very important role in trauma. Let's talk a little bit more about that. Joanne, you're a cancer survivor yourself. Tell me how that offers a unique perspective to your patients, and what role does that play in the journey and your care for them?
Well, I can definitely commiserate with the patients. I know what they're going through. I know how they feel. And I feel that I am better able to speak to them. And I've been given bad news in sort of not a very sensitive way. And so I would never do that to one of my patients.
You're very aware of the way you deliver the news and the information, which is so important. I think that level of compassion is incredibly important.
Yes.
Dr. Mealy, we talked a little bit about trauma. So tell me, when is a plastic surgeon called into a trauma case, and how common is all of your involvement?
Well, it's often related to facial trauma, or it's just a very cosmetically sensitive area. We're called in to reconstruct defects of the scalp, do complex stitching in the facial area, and we also cover hand surgery call as well. And I think of all of the reconstructive procedures that we do, I think really extremity salvage in the trauma situation is the probably most important.
Well, absolutely. Things. I mean, what a terrible time for someone to be going through, and to not lose a limb because you guys are called in at that point, I think would be very important and critical for patient care. Dr. Martinez, we were talking about trauma, and how do you approach patient care and work with those such diverse cases where it could be a child who's cut open their head and it could be an older adult who was in an accident? How do you approach each patient and their individualized care in such a diverse field?
Yeah, so I'm sure Lino can testify to this. I think That's one of the things that got me into plastic surgery, is the beauty that we can work in such a diverse circumstances, whether there's a head-to-toe, pediatric, newborn, up to a geriatric, inside and out. So in general, it's a very broad field. You learn the techniques and basically you approach every problem individually, because there's no cookie-cutter approach for everything. So
no two cases are the same.
not the same at all.
So you're really
That's what's
taking
exciting.
all of the procedures and the tools in your toolbox and applying it to
Absolutely.
each situation. I can imagine that is pretty really interesting
Wakes me
work.
up every morning.
You know, Joanne, what's the one thing that you want every patient to know about their options regarding plastic and reconstructive surgery? Because there are so many options out there, and I think that people may not realize how many things you all can help.
Absolutely. I think patients need to know that they can ask questions. Go home, look things up on the internet, come in with questions, call us up. Don't be afraid. Get all your knowledge, make an informed decision about your body. This is your body. You know, we can tell you what we think might be the best for you, but it's really your decision.
Thank you so much to our panelists and to our audience. Thank you so much for being here. This has been a great in-depth and informative conversation. Up next, we're going to take questions from our live studio audience. Stick with us. You're watching St. Luke's Health Now.
Approximately a little over a year ago, I was splitting wood in my house with my family, and I was trying to lift these huge logs up onto the log splitter by myself. My father-in-law was walking by. He saw me struggling. He came over and offered to help. We weren't on the same sheet of music, and I ended up moving the log once. He thought it was ready. He ran the ram forward. I went to reposition the log, and I stuck my finger down in between the log and the ram, and it crushed my pinky. The first thing running through my mind when this injury occurred was, am I going to be able to work again? As a police officer, this is your hand. This is what you use for everything. Hopefully nobody ever has to experience a traumatic injury, but if they ever do, it's nice to know that St. Luke's is there to get you through your difficult time in life.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to all of our audience members, but especially our patients, for sharing their stories with us. And of course, to our wonderful panel, Doctors Mealy and Martinez, and physician assistant Joanne Mulligan. We've had a great discussion on plastic and reconstructive surgery at St. Luke's, but now we're going to take some questions from our studio audience. We got a whole bunch of questions here, so there's a lot of things to get to. Joanne, I'm going to start with this one for you. How is a patient's physical condition evaluated prior to plastic surgery?
Well, we typically evaluate the patient. We do a history and physical on them. We determine whether or not they would require anesthesia for their procedure, and if so, we may need to get medical clearance, cardiac clearance, things like that prior to the surgery. So sometimes we have to send the patient back to their cardiologist or their medical doctors just to make sure that they're healthy enough to undergo anesthesia.
So they really get a complete workup before you even go to that next step.
They can, yeah.
Excellent. Okay, Dr. Martinez, this question is for you. Does breast reconstruction interfere with chemotherapy? And I would imagine that's a pretty common question.
It is indeed. So breast reconstruction in general does not interfere with chemotherapy, in the sense that we can time our reconstruction, depends on the patient needs. So depends on the stage of the cancer, we can plan the reconstruction to do it right away after the mastectomy, or we can do it later on with all those adjuvant therapies already made.
Excellent, thank you. All right, this audience member asks Dr. Mealy, where does counseling intersect with performing plastic surgery?
Well, it really overlaps with getting to know the patient, understanding where they're coming from, what sort of life situation that they're currently in, how they see themselves. The first thing that I do for a cosmetic patient in particular is put a mirror in front of them. What do you see? What bothers you? And if it's within reason, if it's really affecting their daily life, then sure, I mean, it's probably something worth doing.
Several people in the audience asked this question, which is, why did you go into the field? What's the best part of the job, and what's the most challenging? So that's a lot of things, but if you guys can each go down the line and tell us why you went into this field, what you love best about it, and what you find most challenging, that'd be great. Joanne, we'll start with you.
Well, I just think there's nothing more fascinating than the human body. The best part of my job is basically the final product. Your patient is happy, they feel good, emotionally, mentally, they're happy their cancer's gone. It's just a good feeling. It makes you feel accomplished.
Great. Okay, Dr. Martinez, what about you? Why did you go into this field? What's most challenging and what's most rewarding?
Yeah, so the most rewarding part of my job is just it's fun. Every day is different. You know, you don't wake up one day thinking you're going to do X, Y, and Z. You get presented with problems and you have to kind of figure out how to manage. So in a way, it's a more artistic specialty that you basically have to create your own art and your craft on a daily basis. The same token, what is a challenge in my field is like every day I get challenged on a medically basis and an emotional basis. So some things are not really on the book and you kind of have to improvise things and then come up with a plan. But that's the nature of our field and that's why I enjoy it.
Right, so the challenge and the reward are really one and the
It's
same
always
for
there.
you. Dr. Millie, what about you? Why'd you go into this field? What's most challenging and what's most rewarding?
Most challenging aspect of it is that we can operate head to toe just about anywhere on the body, and really having an up-to-date knowledge of what is the most current method of reconstructing. And it's really what drew me to the field was the fact that it's an innovative field. There are no boundaries to plastic surgery. That's a challenge. I'll say it's also the reward of it, because when we're successful in reconstructing something that's really complex that, you know, the surgeon or the other physician who's saying, oh, this is going to be nearly impossible, and we do it, God, that's, you know, the really most rewarding aspect of it all. And the patient benefits from that.
I would imagine that that really is where the payoff comes in, is seeing those patient results and their reaction to having changed their lives in such a positively dramatic way. So thank you all so much for being here. For more information on plastic and reconstructive surgery at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.